Hello, and this presentation will focus on spinal cord injury and how someone who's diagnosed with it, how they exercise throughout their day, and just how they function in general. So what and where is the spinal cord? The spinal cord is essentially a collection of nerves that travel from your brain to the back of your neck, and it allows for functioning through your arms, legs, neck, just your muscles in general. Um, Prior to being diagnosed, someone would have to undergo a medical history and a physical examination, which could involve x-rays, just questionnaires, and then to see if their symptoms match up with the symptoms of someone who would have spinal cord injury. This can also be classified as complete or incomplete, and complete means that there is no function whatsoever but level of injury, whereas you would have some function below your level of injury during an incomplete. This illness is commonly found in young Caucasian males, and shoulder pain, depression, cardiovascular disease, obesity, and other factors also play a role with this. LS, L2 to your S2, lack control of your bladder, sexual functions, and other functioning. T1 to T6, these are your autonomic dysreflexia. Poor thermal regulation and uncoordination are some factors. C5 through C8, your shoulder, your elbow, your wrist, your decreased hand motions. So you're basically seeing someone struggle doing things such as just lifting their hands, lifting weights, and then C4, which essentially requires support for breathing. So exercise testing, special considerations, a functional assessment should be taken prior to testing just to see like if your patient is in a wheelchair, how they function beforehand, transfer mobility, upper and lower extremity. Consider the level of SCI and levels of activity that the client would need. So offhand, you should be able to determine if they should participate in physical activity. If so, how much, what intensity rates, the amount of, if they should have weight, reps. When using certain equipment, ensure that it is wheelchair compatible. This is important because most clients with spinal cord injury will either be in a wheelchair or some type of device that helps them move around. So just making sure that equipment, ergometers, just biking in general, that they can be used for people with wheelchairs. A wheelchair roller system or a motor-driven treadmill, and also educate your client on post-exercise, such as fluid. Try to take in or consume at least a good amount of water after your exercising. Elevate your legs. This just helps with circulation, and then also just rest. So exercise training, special considerations. During training and competition, the use of light clothing, ice vest, protective sunscreen cream, and mist spray are recommended. This is just because people with spinal cord injury will be out of their element, so trying to get them to adjust to a new environment, it just won't happen. Like they'll have to, have light clothing to take away from extra weight being on them, and then just getting used to equipment. Also, there are no special considerations for the assessment of muscular strength regarding the exercise testing mode beyond those for general population, with the exception of lesion level, which will determine residue motor function, need for stabilization, and accessibility of testing equipment. So moving into the FIT principle, I've broken them down into aerobic, resistance, and flexibility training. which they will kind of be the same, but for each different level, it will most likely decrease due to the amount of resistance or flexibility. So for aerobic, 2 to 3 days a week, eventually 3 to 4 days, no more than 3 to 4 days. Intensity about 40 to 60% of their VO2, light, very light intensity to start off with, and then you could possibly progress to moderate intensity. Time, 30-minute sessions per day, progressing to 60-minute sessions a day, being that 60 minutes is kind of the standard time for young adults and youth, or just anyone in general. 3 to 5 minute rest intervals, and then types of activity they could participate in. The treadmill, again, just make sure that it is wheelchair or whatever kind of device that they're in to help them move around compatible. The cycle ergometer. And then for resistance, about 2 days, 2 to 3 days a week, with three being the most, and three being the most after they're very comfortable with the 2 to 3 days. Intensity about 50% to 80% of VO2. Very light intensity. Try not to move it up to moderate until they're comfortable. Time, 30-minute sessions, 2 to 3 sets of each activity. Progress to 60-minute sessions with 5 to 7 sets per activity. And then the types of activities, they could do these from their wheelchair or just move to a regular seat. So ankle weights, maybe a cable column, kind of pulling down, trying to relax their muscles, and then just any type of light weight that will not put a strain onto the patient. Flexibility, 1 to 2 days a week. Just keep it at the very minimum 2 days a week. Very, very light intensity, being that their spinal cord, you're basically trying to help them stretch it out, but you also don't want to hurt it any more than how it's already hurt. And time, 20 to 30-minute sessions. I'd say about 2 to 3 minute rest periods, just depending on how they feel. Some patients only need about 30 seconds of rest with flexibility. And then types, dynamic, static stretching. So just laying out, doing the like a deadlift, or yoga, just stretching out over a foam. They could lay over a foam and stretch out their spinal cord. And unique special considerations. So compressive stockings, elastic abdominal binder, and electrical stimulation can all be beneficial. This is just to help, again, with someone who is trying to basically adjust to an environment and take off a load of what they're used to wearing, and getting them so that they can actually train and be in a stable environment. Always monitor heart rate and blood pressure closely. If at any time the patient feels that their symptoms are getting worse, or that they're about to faint or are dizzy, just stop training completely. Muscular strength training sessions from a seated position in the wheelchair should be complemented with non-wheelchair exercise bouts to involve all trunk stabilization muscles. And shoulder muscle imbalance should be monitored heavily, just because the shoulder and the back area are mainly the muscles and the areas that are being used for spinal cord injury.